Chapter 12. Support for Fire Emergency Services and their Vital Functions. Objectives. Describe the evolution of EMS. Describe the level of care provided by EMS and explain the importance of higher education in EMS. Define emergency management. Identify the 4 areas of responsibilities of emergency management and explain the function of the LEPC. Healthcare professionals provide pre-hospital care in many jurisdictions. The first ambulances were actually Hearst. In the military, field medics and helicopters were used to evacuate wounded soldiers during times of war. And actually, it was in the Korean War, if you remember the old MASH, 407 show. This is a good example of how helicopters were used in battlefield to get wounded soldiers out, to get them to miniature trauma centers or definitive care to help reduce morbidity and fatality. In 1966, the DOT established and gave responsibility for improving, were given the responsibility for improving EMS education. Essentially, this was kind of the result of a study that was done, and it basically saw that there were a tremendous amount of accidents on the roadway and a whole bunch of fatalities resulting from those accidents. So the government decided the DOT would be the best federal agency to go ahead and try to curb this epidemic. So they basically came up with the concepts of EMT and paramedicine in the field. Still today, they dictate the curriculum. However, there are other private agencies that help with training and credentialing, or testing, I should say, of EMS personnel. And that's the National Standard Curriculum and the National Registry of EMTs, which was established in the 1970s. In the 1980s, EMS added advanced life support to their repertoire so they could even provide better care. And this is all in a time where, if you look in the history of EMS, in the late 60s, early 70s, there was a show on, and feel free to Google it, and you can watch some clips and some old scenes of the show Emergency. And Emergency basically showed 2 fire medics in California that were saving lives and making a difference. So this really brought EMS into the forefront room of every American household that watched this major primetime show. And they started expecting that level of care from their own fire department. So that's kind of what got us started in the terms of modern EMS. It showed every week these paramedic firefighters, saving lives by starting IVs and things of that nature. So it really created a demand across the nation, encompassed with this white paper that talked about how trauma was a neglected disease, to really start improving our pre-medical response on emergency scenes out in the field. Where prior to that it was just the Hearst. The Hearst would go out and actually they'd fight over the dead bodies. Apparently, I guess they got more money over taking them to the funeral home as opposed to the emergency room. So we kind of grown from that to our modern ambulances, where we can do many things in the pre-hospital setting, from EKGs, IVs, and certain drugs. In 2010, the American Heart Association set new guidelines for CPR, emergency cardiac care, and automated CPR devices may also be found in ambulances. So we're really growing with what we can do in the field. And I hate to say it, they don't call it practicing medicine for nothing, because every year they come out with new studies and new technology that find better ways to do things, or find that what we have been doing in the field may not have been as effective or even detrimental. So some questions. How does your community respond to EMS? Are there mutual aid agreements in place for mass casualty instances? And what level of care does your local fire department provide in your community? And what you're going to find here is in your community, EMS, your ambulance, can either A, be a part of the fire department, B, be its own separate government third service, or C, it may be a private company that is contracted to handle the EMS duties for the community. And there's several great examples around here in Athens, Georgia. So for example, you have National EMS, which is a private company that runs all the 911 calls for Athens, Clark County, and Oconee County in this area. And then you have the fire department that just does, fire responses, but then they also respond to help assist with EMS on your major EMS calls in terms of car wrecks, cardiac arrest, shooting, stabbings, things of that nature. So that's a good example of how the government is contracted with a private company to handle that responsibility. Now, if you wanted to go just up the road a little bit to, say, Walton County, they have an EMS service that is a third service. And what I mean by third service, you have your sheriff's department, you have your fire department, and you have your EMS department. So they all act independently, as opposed to coming from one organization. And then you have other departments, like around Metro Atlanta, for example, Henry County, Gwinnett County, Barrow County. They have the ambulance service that is incorporated within the fire department. So they run the ambulance service as well as, of course, the fire responses. So what do you do in the case of a mass fatality? And that's kind of what these next couple slides are talking about. Not one community can be prepared for every disaster. And what they mean by disaster, let's look at maybe some sort of, I hate to say it, but in the wake of recent events in the news, some sort of school shooting. Does your community have the ability to handle, 13 people that are shot at once? And really, a mass casualty incident can be anything that overwhelms or tax your current level of service provided to your community. So, in order to help with that, what they have are mutual aid contracts. And that basically says that, hey, my neighboring communities will help you in the event of disaster, and you help us. So, that's kind of one way they get around this whole deficit in terms of mass care. When we're looking at our training for EMS levels, now we do know that many fire services also have EMTs, paramedics, so forth and so on, but there are different levels of training. And the first is being your EMR, emergency medical responder. And this is kind of like basic first aid and CPR. Then you have your next level, which is your emergency medical technician, which kind of expounds or builds to another in-depth layer than the EMR, and they can do a few more skills. And then you have your advanced EMT, which can now start IVs and give some basic drugs to help in certain medical situations. And then at the top of the EMS training pendulum is your paramedic, and your paramedic can do all sorts of things, such as insert tubes into the trachea called endotracheal tubes that help breathe for the patient, of course starting IVs, peripheral as well as in bone with IO drills, and that means interosseous. And of course, reading cardiac monitors and giving a whole host of narcotics and cardiac drugs as the situation dictates. Of course, with our EMS model, you also have professional development or areas of advancement. And this is similar to the fire service model, But you can see here how their progression goes on up to EMS chief officer, EMS executive, manager, supervisor, and specialty credentials. So these are all pathways for folks in EMS to further their education, kind of like your fire officer 1, fire officer 2. Now, it is important for a career as an EMT to maintain their credentials with the state. It's important to note that you have things called credentialing and licensing, or certification. And credentialing or licensing, you're basically looking at a state agency giving somebody a license to practice medicine, so to speak. And you have other, like private organizations like the National Registry of Emergency Medical Technicians, which they don't give a license, they give a certification. Now, the certification in itself does not give you the right to practice medicine. However, what you'll find is the National Registry does put a test out, and this test reviews the hands-on skills and the cognitive test to make sure you have the basic fundamentals to function at a paramedic or EMT level. And then what the states do, they take that test, and if you pass it, then they'll give you a license to practice medicine. So that can kind of be a little confusing. But in order to maintain your license in a certain state, you have to have continuing education, or CEU units. And in Georgia, you have to have 40 hours of approved continuing education every 2 years, in addition to CPR and ACLS if you're a paramedic. The National Registry, again, is a private organization that offers a certificate, and if you want to keep that certification current, they have, I want to say, 72 hours that they require every 2 years. But this training is in a variety of different topics, such as pediatric patients, trauma, medical emergencies, and things of that nature. Now, most firefighters also have EMT duty, so they're also credentialed that way. So not only do you have your hours to maintain for your fire side, you have your EMS hours to maintain as well. So that's an example of one of those dual certifications. If you look at the trend in emergency calls now, we are going away from fire-related calls due to better education, sprinkler systems, and building materials. So it's really lessening the number of actual fire type calls we go on. However, with the current population of baby boomers getting older and needing more medical care, our EMS calls are on the rise. And this year is kind of a really generous graphic in terms of medical aid, saying 65%. If you probably poll most departments in the area, they would probably say anywhere between 70 and 80% of their call volume has to do with some sort of EMS type call. So another facet that sometimes can fall on the fire service is emergency management and homeland security. Now, don't get confused with EMS. This is separate from EMS and fire. Emergency management basically has to deal with disaster management in terms of like terrorist events, tornadoes, hurricanes, things of that nature. Now, their main focus is to mitigate the problem or minimize it or get things back to normal, or have a plan, a contingency plan to deal with factors that arise during such disasters. And that's kind of known as an all hazards approach. Having shelters identified and special equipment staged, and things of that nature. Excuse me. So in order to be an emergency manager, you should really have the following characteristics. You should have great oral and written communication skills, and you got to be organized to the nines. You need to have the ability to coordinate multiple department and multi-agencies, because again, this is an all hazards approach. You need to be able to work with the sheriff's department, police departments, fire departments, city managers, private entities, and of course come up with a plan and then execute that plan. So this kind of all falls under the FEMA umbrella. and the timeline of important events for FEMA, and that's Federal Emergency Management Agency. So Congress Act of 1803 was the first time federal funds were used in disaster recovery. During the 1930s, federal loans were given to local governments to repair public facilities, roads, and bridges, and that's kind of been the mainstay for these national disasters, and that's kind of what FEMA does. They are federal employees, they come in, they try to help the communities get back together on their feet and growing again, and that's done through cleanup, mitigation, loans, things of that nature. So some other important events, you had the Flood Control Act of 1934, which authorized U.S. Army Corps of Engineers to develop and implement a flood control products. So basically that was when you have a lot of these dams that started going into place to help with flooding. And of course, you look at them, a lot of them were also turned into power plants. Now, another important date or executive order is 12-12-7, which authorized the creation of FEMA to kind of oversee all of these areas of emergency management. So they were basically given the task to have communities develop a disaster plan, and that plan must be tested, meaning through exercises or real life to make sure that it's going to work, and that they should adopt the NIMS training, which you guys should have already had with 100 and 700. Now, emergency management begins at the local level. So when we're looking at our emergency management, you're looking at your counties. Now, cities aren't required to have emergency managers, but some may do. But if you look at the organizational chart, each of the counties in Georgia have their own emergency manager, and that emergency manager is responsible for the entire county in terms of cities and land. So that emergency manager then requests aid from the state, and then the state disseminates what they can, and then if the state can't handle it, then it goes up to the feds. So the definition of emergency management. Emergency management is the managerial function charged with creating the framework within which communities reduces vulnerability to hazards and cope with disasters. Prepare for a disaster and basically recover from it. That's what emergency managers do in a nutshell. So with your emergency management planning, your focus needs to be very comprehensive when you're looking at these detailed oriented plans, but they also need to be progressive in the sense that they need to be flexible and you need to be able to think outside the box. And what I mean by risk driven is what are the odds something is going to happen and how bad is it going to be? And then that's kind of what you start planning for. Then, of course, it needs to be integrated, meaning you have buy-in from all parties. You need to have collaboration between all agencies. It needs to be coordinated, and your plan needs to be, of course, flexible to be able to grow and contract as need be, depending on the scope of the incident. Now, with preparedness, local plans are based on guidelines which are set forth in the National Response Framework. And it basically came up with 15 emergency support functions. And those emergency support functions take all the services or general categories of services like utilities, fire response, law enforcement, and they're all put into groups. And then those groups are tasked with getting supplies and things of that nature into a staging area, and then they filled in the requests from the local emergency managers. And this is kind of going from the state level. It could also be local if you had a big enough county, but those people in the emergency management command center disseminate those resources. So questions, is your community's emergency response plan up to date and has it been tested? And it should be if you're getting federal funding. Why is it important to maintain a current emergency response plan? And I'm going to go ahead and tell you on this. People change out of positions, so your contact numbers and people who have keys change on a regular basis. So it's important to keep that information up to date, as well as having these new people come in be familiar with the plan prior to an emergency. All right, in your community, who should be involved in developing the plan? And we've already kind of discussed this, so we really think it should be everybody. And does your community have mutual aid agreements with other communities and also in the private sector? So let's now look at the phases of emergency management. The first is going to be response, which involves the activation of your emergency response plan and all those emergency support functions from the National Response Framework. This involves maintaining an efficient and effective command structure and operation center. So think you have your disaster over here, and then, so many miles away you have your headquarters, if you will, our command center, and they kind of coordinate and facilitate and get all the needed equipment and personnel to the scene. Now on the scene you will have, say, an operations person in charge or an incident commander, and those are going to be the one relaying back to the command post what stuff they need to get the job done, from manpower to equipment. Here's an excellent picture of a command center with all your different ESF groups, and these tables will have the different group numbers, like say 5 is law enforcement, 15 is EMS, maybe 12 is utilities, etc. Now there are 3 basic goals which must be accomplished with a response phase. The population must be protected, and the damage from the primary impacts must be limited or mitigated, and damage from secondary impacts must be minimized. So that would be like saying, okay, the tornado came through and destroyed buildings, and now we want to limit the damage of that by providing temporary housing or sheltering, or whatever the case may be. And in the primary impact, you may say you start having tornado sirens put up, or whatever the case may be. Okay, so some more questions. How would your community respond to a major disaster? And how would mutual aid agreements aid in that response? So let's think about that one for a minute. If you get hit by a tornado, odds are your neighbors also going to be dealing with events from that tornado. So, food for thought. Does your community have the resources to effectively activate the emergency response plan? And how would the resources be tracked as they are used? Recovery is the next phase, and its purpose is to restore the community to the same status as it was before the disaster. 30% of the response is still in operations when recovery begins. Short-term recovery involves those activities needed to restore the vital infrastructure needs to sustain the health and welfare of the community, such as power, phone, internet, things of that nature. Long-term recovery begins when the community starts to rebuild critical infrastructure such as roads, bridges, highways, public buildings, businesses, things of that nature. So actual long-term recovery may take months or years to complete. Now, another phase is mitigation, and this really kind of occurs throughout the other 3 phases, but it warrants talking about it now. So their overall goal of mitigating is to either A, prevent the disaster from happening altogether, or be proactive in terms of minimizing some certain disaster by putting in preventative measures. Maybe it's putting barricades in front of a government building to prevent, terrorists from driving a van full of explosives in there. Or again, maybe it's, tornado sirens or things of that nature. And then, of course, reactive would be ways to minimize the disaster. So let's say there was major flooding, and now to help minimize the flooding, you're going to help with sandbags or suctioning water out. So proactive mitigation begins with a hazard and risk assessment during the preparedness phase. And reactive mitigation begins at the end of the response phase and throughout the recovery phase in terms of emergency management. Now, weaknesses are exposed and consequences of the failure are evident during mitigation. Now, the question to ask is, when these disasters happen, how did the failure occur, and what can be done to prevent or reduce the impact of future disasters? And the cost of a reactive mitigation is much higher than proactive. So let's say that you had a flooding event at a river and a mobile home park was washed away. Now, do you rebuild that mobile home park on the edge of the river, or do you B, say, okay, let's buy that land and turn it into a community park because, it's a possibility that's going to flood again. So instead of having that potential loss of life or property, we just make it a green space. Now, there's all kind of post-secondary education programs out there for emergency management. You can get your master's degree, PhD, or even bachelor's degree. And I really think that in the coming years, we're going to see more focus on emergency management as, disasters continue to increase. So, summary, fire and emergency services do go hand in hand, and that's what we're talking about here with EMS and, of course, emergency management. A lot of times your fire folks have a hand in all three, but again, they may not. So, various levels of training are required for your EMTs as well as your emergency managers. As I said, for fire service as a whole, you kind of have to be a jack of all trades and a master of none. Because we're just so versatile and do a little bit in regards to everything. Okay, guys, so if you have any questions, you can email me at aroberts@athenstech.edu, or you can call me in the office at 706-357-0162. Until next time, be safe, have a wonderful day.